All. I welcome all the participants from the various states of our country, all the participants, faculties, uh, some of the guests who might have joined, and I also welcome our respected Associate Dean, Professor Dr. A.U. Bikane sir, and I also welcome some of the I will welcome. I think Dr. D. Sumati Madam has joined. Welcome, Sumati Madam.
Yeah, good evening, sir.
Good evening, Madam. Welcome.
Yes.
Now, today's we have three presentations from the esteemed speakers. First of all, Dr. Shibu Simon, sir, will be delivering his lecture. Second one, Dr. Neetu Saini from Gadwasu, Ludhiana. She will be delivering her presentation. And lastly, Dr. Sambhaji Chauhan from Udgir Veterinary College, Maharashtra. He will be delivering his presentation. So today we have all the interesting three topics, very important topics. So all the participants are requested to please pay attention and take utmost advantage as you can. And with this, now I request our co-coordinator, Dr. Mahesh Ingole sir, to introduce our first speaker. Dr. Ingole sir, please.
Good evening to all the beloved participants, respected speakers. Now, this is the fourth day of the National Online Training on New Horizons of Canine Disease Diagnostics and Therapeutics. Now, I am Dr. Mahesh Ingole, co-coordinator of this training program. I warmly and heartily welcome to all the dignitaries on this online platform. Now, on the fourth day, now we have a galaxy of speakers with the new subjects, and the first presentation is on the very important topic of this training, that is the common reproductive disorders in canines and its medical management. Now we all know the problems which are very commonly occurring in the canines, and very scanty literature and experienced faculties are there to solve this or resolve these reproductive conditions in canine. So for this presentation, now we have a very experienced, rich practical experience personality, Dr. Shibu Simon, and it's my pleasure and privilege to welcome my professional senior friend, Dr. Shibu Simon sir.
Thank you.
And I will briefly introduce Dr. Shibu sir. Now, after his post-graduation, Dr. Shibu sir has joined the Department of Animal Husbandry, where he has worked for 13 years as a veterinary surgeon. And after that, he joined the academics as assistant professor in 2008 in the Kerala Agriculture, Veterinary and Animal Sciences University. Now, area of specialization of sir is the concept of ecobiometry, Doppler ultrasonography assessment in canine pregnancy. He has published more than 60 research papers and authored one book on breed care and training and reproduction of dogs in vernacular language. Now, being a researcher in the academics, sir has implemented state plan projects worth of 5.25 crore as a PI and OPI. Now, he has guided 18 postgraduate scholars as an advisor, and he has undergone a CPD training program in abdominal ultrasonography of 6 weeks by Royal Veterinary College of London in 2012. Now, he was the recipient of Travel Fellowship Award in 2016 by National Science Academy. He has various awards on his credit, that is Travel Fellowship Award by CICS, Dr. Thomas Joseph Award for the Best Veterinarian, Appreciation Award from the Kerala Veterinary Animal Sciences University and Indian Veterinary Association, Kerala. Now, his major achievement in the field of reproduction or canine reproductions are the centration of EVC, hormonal induction of estrus, semen collection and AI in the canines, subject matter specialist in various continuous veterinary education programs, undergone a CPD in abdominal ultrasonography by Royal Veterinary College. Now, sir is the course director for the PG Diploma of Small Animal Therapy, and some of the participants also registered for this course also. Now, he is a representative for India at a Federation of Asian Small Animal Veterinary Association, and he is the state president for Small Animal Veterinary Association, Kerala from 2017. So, on behalf of the organizing committee as well as Postgraduate Institute of Veterinary Animal Sciences of Akola, I warmly welcome, sir, for your sharing rich experience in the field of the canine reproduction. And I request you to start the presentation, sir. Thank you.
Let me share the screen.
Yes, sir.
Hope my screen is visible.
Yes, sir. Yes, sir.
Yes, sir.
I'm audible also.
Yes, sir.
Yes.
So, good evening, one and all. It's a great pleasure and privilege to be here with all of you, all the dignitaries and the delegates, especially this evening when we are discussing on a topic that I love the most. And at the outset, let me thank Dr. Bikane sir, the course director and the associate dean, then Dr. Wagmo sir, the course coordinator, and the co-coordinators, Dr. Pasay, Dr. Hasi, and my friend Dr. Inkwale. And I welcome all the delegates also once again to the program. So we will start with the topic. And as you see on the board, I have slightly modified the topic because we have only limited time. So I am just confining my discussions to medical management of common reproductive problems in female dogs using hormones. And as far as possible, I try to be in time, but I may exceed a few minutes, that's all. So that is my plan. And it will be somewhat faster also because we have to cover a lot of topics. So with that brief introduction, let me go to the topic. As you all know, the reproductive biology in the bitch has been described like monoestrous, typically non-seasonal, polytocous, and spontaneous ovulators. And there are a lot of differences from farm animals. So that is a basic thing that we, most of us are familiar also, but even then just to recap your memories, they have a prolonged follicular phase and a prolonged luteal phase. And the ovulation in the case of bitches occur at the beginning of estrus, whereas in farm animals, as you know, it happens after the, maybe if you speak about bovines, something like 10 to 12 hours after the end of estrus. The lifespan of corpora lutea, whether the animal is pregnant or not, it is the same in the case of canines, unlike in other species. And pre-ovulatory luteinization of follicles is another phenomenon that is seen in canines, which is not seen in other animals. That is why there is an increase in progesterone level even before estrus. And the bitches do have a single follicular wave, whereas in bovines, they have 2 or 3 wave cycles. So these are some of the differences. And again, in canines, the ovulation happens 38 to 44 hours after LH peak. That is almost 2 days. And the ova are released as primary oocytes, which takes another 48 to 72 hours or 2 to 3 days for them to become secondary oocyte. That is a fertile stage. So when you look at the hormonal control of estrous cycle in canines, so this is a typical estrous cycle with a 6 month duration. How it spreads over, you can just see, but I may not be able to describe all of them because of the lack of time. But you can see that the most of these hormones have very wide variation in canines, especially the progesterone and estrogen. the peaks are very high and the lower values are basal values are like, say, if you speak about progesterone, the peak value is somewhere around 15 to 60 or even more, whereas the basal value is 0.2 to 0.5. So that is a concept. Just I am bringing you all into the concept of this topic. So the variation in hormonal level is too high. So this animal, if you want to play with the reproductive cycle, actually it's a tricky animal also. So we have to understand lot many things before we use the weapon also. That is what I am trying to convey. And very rarely this progesterone level even goes beyond 60, and even normally at times it may even touch 80 also. That is what we have seen. And now going to the topic, hormones used in canine and feline reproduction. There are a lot many, almost 10 of them are there, and we will just discuss them. Before that, I would like to start with the wonderful statement that hormones are double-edged weapons. So they'll be useful on many clinical situations, but judicious use of hormones is the need of the hour, or that is very important as far as the management of clinical conditions are concerned. And they are excellent clinical aids also once we use it judiciously. That is what I would like to convey. And the first group of hormones that I would like to discuss is about progesterone antagonists. They include mifepristone and aglipristone. And the general side effects like nausea, vomiting, uterine cramps, which are reported in women, are not reported in bitches. The specific adverse effects or adverse side effects in bitches are resorption, abortion, or premature parturition. Progesterone antagonists, they have high affinity for progesterone receptors, and it is calculated like they are having affinity 3 times greater affinity than that of progesterone in canines, and whereas in felines it is even 9 times higher. So that is the advantage of this molecule, and they bind to progesterone receptors of the uterus without producing the physiological effect of progesterone. That is their action. And during pregnancy, when we give it, we can expect fetal resorption, abortion, and they can be judiciously used in whelping induction protocols. And during non-pregnancy, uterine and they are used in uterine and mammary gland conditions in bitches and queens. And certain other advantages of antiprogestins: no severe side effects are reported with this agent, as reported for, say, bromocriptine, cabergoline, tamoxifen, dexamethasone, PGF compounds, or estradiol, cyclonate, etc. And no adverse effect on long-term fertility. That is also the greatest, one of the greatest advantage of this molecule. Mifepristone is a progesterone and glucocorticoid and antagonist, and it is more potent as an antiprogestin. This point is also very important. So the anticorticosteroid action of mifepristone is limited to doses of greater than or 20 to 50 milligram per kg, whereas it is not at all observed when we are giving it at less than or equal to 5 milligram per kg. That is a maximum dose that we are going to use. Then the second group are the antiprolactinics. They include dopamine agonists like bromocriptine and cabergoline. They are essentially ergot alkaloids, and they have strong dopamine D2 receptor agonistic activity, and they can reduce prolactin secretion. And serotonin antagonist metrogodin, since it is not available in India, we may not discuss further on that. Then, as you all know, prolactin is a major luteotrophic hormone in canines, and by day 30 after ovulation, prolactin is an absolute requirement for canine and feline progesterone secretion and maintenance of pregnancy. So that is also a knowledge that we must remember when we use it for clinical, or when we clinically use it. And the adverse effects of antiprolactinics like nausea, vomiting, lethargy, and constipation can be reduced to a great extent by mixing the drug with food. And if you properly use it, most of the side effects may not be there. And minimizing the dose to the least effective level is the most important part of using this drug. And maybe some people will be using some acids or something like that. But without that also we can manage if you minimize the dose. Side effects are lesser and manageable with cabergoline. About bromocriptine, see, it is not an approved drug for small animal practice in many countries where legislation is implemented strictly because of their side effects on the cardiopulmonary system, hypotension due to vasodilation, or MS because of the chemoreceptive triggers on simulation. These are too much with the drug, and they have a short half-life also, so it has to be given twice daily. So because of these reasons, it is no more a drug that is considered for any use in canines. Prostaglandins, they are luteolytic and uterotonic, and they have tocodynamic action. And PGs used in canines include dinoprost, cloprostenol, alpha-prostol, and misoprostol. The general side effects, whatever we expect of using PGs, like like vomiting or salivation, those kind of things. These side effects are dose dependent and decreasing in intensity with repeated dosing, and maybe these are all self-limiting if you judiciously use it. That is what our clinical experience says. And misoprostol is comparatively a newer molecule. It's a synthetic analog of PGE1 with a strong uterotonic action and no luteolytic action. And the dose of, in bitches are 10 microgram per kg twice daily. And in queen, the dose is something like 50 to 100 microgram per queen orally, or both the animals, both the group we can give orally or intravaginally. And what is suggested is something like these compounds are gradually replacing most of the PGF compounds in canines and dogs and cats, especially with those with pyometra, because they are orally active and most of the side effects are absent with this molecule. And this can be diluted in saline solution and injected directly into the vagina to facilitate say cervical opening or whatever action we are expecting. And one important point about the pharmacokinetic properties of misoprostol, whatever research are available are with women only. So I will be using that only here also. And the uses in women are medical abortion, cervical priming, miscarriage, induction of labor, postpartum hemorrhage. And when we compare with oral and vaginal route, the onset of action is faster. You can see is faster with oral route. Peak action also is faster for oral route, whereas the duration of action is more with the vaginal route. It is almost double, almost 4-hour duration we'll get. And one more point about oral administration is that when we give orally, the researchers says that first administration of the drug may not give the effect that we expect, whereas on the second administration onwards only, orally it will become active or effective. So the vaginal route also has that advantage also. With the first application itself, it becomes active, it becomes effective. The current recommendation with regard to maximum dose of PGs, see earlier we were using very high doses, but nowadays we have reduced the dose, like for natural PG, something like 25 to 50 microgram per kg. And for cloprostenol, 1 to 2.5 microgram per kg. For so we have already discussed. For the queen, natural PG may be slightly higher dose, like 80 to 100 microgram per kg subcutaneously, or one subcutaneously, but once daily only. Whereas cloprostenol 1 to 2.5 microgram per kg, and the side effects are fewer in queens than in bitches. And one important point, again, I am reminding you, starting with smaller dose of 1/3 to half the dose on the first day, and or the first 2 administrations. By that way, we can control many of the side effects associated with this molecule. Coming to the next molecule, that is the gonadotrophins. The adverse side effects include hyperestrogenism, thrombocytopenia, unpredictability of ovarian response, then antibody formation. And when ECG, for example, is given during estrus, it can lead to follicular capture and prevention of ovulation. And excessive stimulation of ovary can be another aspect wherein there will be persistent estrous behavior and elevated estrogen for longer duration. And gonadotrophins are the next group. In the same, the examples are that whatever gonadotrophins we use are GnRH agonists like beserlin, leuprolide, or deslorelin, and exogenous gonadotrophins like ECG or equine chorionic gonadotrophin, human chorionic gonadotrophin. The GnRH agonists emphasize the importance of pulsatile injection of GnRH for estrus induction. That is why it is almost limited to research purpose as far as estrus induction is concerned, because every 60 or 90 minutes we have to give injections, which won't be possible practically in field situations. Progesterones, they have the specific adverse effects of like cystic endometrial hyperplasia, endocrine imbalances, mammary nodules and hypertrophy, pyometra in females. High doses in males may result in poor semen quality, and most of these side effects can be controlled to some extent by avoiding very high doses and long duration of treatment or wrong choice of the candidate. So that is about progestogens. Estrogens, when we speak about estrogens, they are known to produce dose-dependent mammary neoplasia. That is a very important complication. And endometrial hyperplasia, pyometra, and irreversible bone marrow suppression leading to anemia and thrombocytopenia. And among the estrogen group, short-acting preparations like estriol are comparatively safer, and they may be used in some cases like urinary incontinence, and very rarely may be in contraception, but usually we have other molecules so that role also. That also we may not be using anymore. So that is why progesterones and estrogens are, as far as possible in canines, we avoid, especially in intact females. Anti-estrogens include clomiphene and tamoxifen citrate. They may induce an estrogenic response due to their partially agonistic effect. Unlike in human and other species, they also have an estrogenic response. And another thing, clomiphene is not effective as an estrus induction agent. No, we have studied this molecule long time back, and what we have seen, it is not effective as an estrus induction agent. Next group are the androgens. They have adverse effects like aggression, clitoral hypertrophy, os clitoris, persistent vaginalis, abnormalities of urogenital system of female fetuses, and high dose in males cause suppression of spermatogenesis. Oxytocin, they have a lot of adverse side effects and contraindications, but most of these can be controlled by adjusting the dose, frequency of administration, monitoring the intrauterine pressure if possible, fetal heart rate monitoring, selection of right candidate. These are the things which we'll be discussing. And the oxytocin uses include, they can be used for medical management of dystocia to induce milk ejection, which may promote milk synthesis by removing feedback inhibitor of lactation. So to induce milk ejection also, this can be tried. Hastening of uterine involution. And then in the treatment of mastitis, to remove toxic milk from mammary glands, some people are using it. So these are the indications. And the last group are the lactogenic drugs. They include anti-emetic drugs and the antipsychotic drugs. Both have prolactin release properties, and because of that reason, they are also included in hormones or hormone group as far as canines are concerned. The first condition that we are going to discuss is about cystic endometrial hyperplasia, pyometra, and based on a recent study we carried out at Brazil, they have found that among the reproductive disorders or pyometra is around 48.8% incidence. So other conditions are much lesser when we talk about these conditions. So this is a very important condition as far as canines are concerned. Pyometra, as you all know, is a chronic diestral infection of the uterus with the accumulation of purulent secretions in the uterine lumen of sexually intact bitches. And that can be with an open cervix or closed cervix. Then they are called open pyometra or closed pyometra respectively. And typical incidence of the condition is almost 1 to 2 months after the last estrus. So that is the stage when they are presented mostly. And diestrus stage is a stage that is dominated by the progesterone. And our concept was that it is associated with middle-aged or those which is over 6 years. But recently we have conducted a lot of studies, and what we have seen, it is almost there in 1-year dog, 2-year dog, 3-year dogs. So likewise, if you classify, almost 50% of the animals are below 6 years, and almost 50 or 52% are above 6 years. That is what we have seen in some of our studies. Now, coming to the treatment of open cervix or closed cervix pyometra, see, by and large, OHE is the recommended treatment in bitches without much reproductive value. That is the first line that we must remember. But with regard to coming to the treatment in valuable dogs or young bitches, earlier times, medical management was considered as the only option in open pyometra, whereas nowadays, with the, ever since antiprogestins have become available, we have started using the same thing in closed cervix pyometra also, because it resulted in cervical opening without any uterine contractions within 1 to 2 days. So that is the advantage of antiprogestins. And in open or closed cervix pyometra, aglepristone is used all over the world, but since that molecule is not available, what we are using in India is mifepristone, what is available here. So that is available as a human product. You might have seen the photos also. It is available everywhere in India. And this molecule may not be available in some other countries. That is also another part of it. So we are using this molecule for the last, say, 10 to 15 or 10 to 15 years or more. And they have been used to stabilize the patient and to ensure surgical fitness also. Before OHE, we can think about using this one to have some drainage of the whatever pus is there, and then safely going for a surgery. For that purpose also, this can be used. Now, coming to the use of antiprolactinics in pyometra, cabergoline can antiprolactinics like cabergoline can inhibit luteal function, and they are more effective in reversing the clinical signs of CH. That is why we always prefer this molecule along with PGF2 alpha. And PGF2 alpha, they are used once the evacuation process has begun or when the cervix is open. Till then, we may not be using that. And in closed cervix pyometra, because of the risk of uterine rupture or can force uterine contents into the oviducts, we may not be in a position to use it at that point of time. So mifepristone or aglepristone are the only option to establish safe cervical patency. So that is a thing that we must remember. So with regard to CH pyometra medical management, I have one suggested protocol which I regularly use. Mifepristone on days 0, 1. Sometimes I may go for another dose on day 2 also, but usually this is a pattern: 0, 1, 7, 14, 21, and rarely it may be prolonged up to day 28. So weekly intervals after the first 2 days consecutive doses. And if it will be given at the rate like 3.5 milligram per kg twice daily per orally. And broad spectrum antibiotic and supportive therapy depending on the case. And when the animal shows definite clinical signs of improvement, cabergoline will be given at 1 to 5 microgram per kg per orally for 12 days or more. And again, cloprostenol will be given along with that at 1 to 5 microgram per kg subcutaneously on alternate days till we get a clinical cure. Usually we might require around 5 to 7 injections. And instead of cloprostenol, we are recently, for the last few years, we are using misoprostol at the rate 10 microgram per kg twice daily. This may be given for say 12 to 14 days. And this gives somewhat good results. And the overall cure rate is around 80 to 100%, and the conception rate will be around 40 to 60%, and recurrence rate will be to the tune of 10 to 40% in combination treatments. So here, one point to remember, cabergoline starting may be prolonged depending on the clinical cure. If the animal is not off feed or it is not taking food, then we may prolong that the starting of cabergoline administration, because once we give cabergoline, otherwise whatever it is, it may have started taking some food, that also will be stopped. So that we have to be careful about the starting of cabergoline in this protocol. Cloprostenol can be started once the cervical patency can be is established, or instead of that, misoprostol can be used. And what we have seen from the day 0 of treatment, the progesterone level, which was around 7.8 plus or minus 0.85. That was around 8 will be the value, or 8 to 10, or some days it will be even 10 to 12. So, and then what we see is that it goes down on day 7 when we estimated. On day 14, it still goes down. And usually we stop treatment when it is below 0.5. That is usually what I do. We stop treatment whenever it is below the basal value, that is below 0.5. And many times we will be getting that value. Very rarely only we may be facing a problem in getting the progesterone value down. And this is another recent study which I would like to bring to your notice. They have used aglipristone on days 1 to 8 and then every 7 days until they got a progesterone value of less than 1.2 nanogram per ml. And they have used cloprostenol at the rate 1 microgram per kg on days 3 to 5. That is 3 consecutive days they have used. Because this study, they claim excellent result. That is why I would like to present. Although aglipristone is not available, we can again think about mifepristone replacing agli with mife. And they have used in all the cases same antibiotic, amoxicillin clavulinate at 12.5 milligram per kg per orally, twice daily, along with enrofloxacin 5 milligram per kg, single time. And the antibiotics were administered for at least 14 days. In many cases, many situations, they have administered the antibiotic for 21 days itself. In our treatment also, usually in the previous protocol also, we will be also using antibiotics for mostly for 14 to 21 days. That is our concept also. Mostly these antibiotics are the ones we also choose. But sometimes we may send for other sensitivity tests and all. And the treatment in this study by Mannuthy et al. 2019 is that they got 100% success as far as medical results of the treatment are concerned, or clinical cure is concerned. And relapse rate was only 8.62%, and the pregnancy percentage was around 92.14%. And they got a litter size on an average of 5 plus or minus 1.89. So 5 plus or minus 2 on an average. So that is what they claim. We have also tried in a few cases with mifepristone, and I'm not yet ready for analyzing everything, because we have to go for the pregnancy rate also. So this is their results. Then the next thing that I would like to discuss is about induction of parturition. That is also a condition that we are facing in the field situation. Mainly, we go for elective C-section on these criteria, on the basis of these criteria. See, nulliparous bitches over 6 years of age, litter size of 2 or less, or litter size of 8 or more, brachycephalic breed, a bitch with previous history of dystocia or familial history of dystocia, to maximize puppy survivability in a precious breeding. Rectal temperature of the dam is below 37.2 degrees centigrade or 99 degrees Fahrenheit. And then when progesterone concentration reaches less than 2 nanogram per ml, or 63 days after LS search, fetal heart rate are below critical levels. Owner lives in an area with limited after hours care, or near to whelping prediction day based on ultrasonography, LS surge, or day 1 cytological diagnosis. We might have predicted that earlier. So based on all these, we select an animal for elective C-section. Majority of these conditions are also applicable as far as induction of whelping are concerned, except those marked way in red color where we have to be careful, and maybe in brachycephalic breed also we have to be careful. But if you can provide clinical assistance, then this is this can be employed, and we are regularly using it in our clinical situations. One suggested protocol here is something like mifepristone, like dose rate 2.5 to 3.5 milligram per kg. 2 doses are given at 8-hour interval, and if it is not working, we may give for 1 more day. And in this particular, initial work, we used oxytocin also, like 0.15 IU per kg subcutaneously to all animals that have not whelped within 24 hours. And what we have seen, 50 to 71% of the animals whelped within 24 hours, and 91.6% whelped within 36 to 39 hours. From the initial mifepristone dose, and the expulsion phase length was around 3.82 plus or minus 0.47, and stillbirth was around 10.8%, which is well within the normal range as far as canines are concerned. And here also we have, when you monitor the progesterone level, what we have seen on the day 1 or day 0 of starting of treatment, the progesterone level was slightly around 4 or 5. And by day 1, it reduced, and in one group, all the animals whelped within say 24 hours, and so we couldn't get any value of progesterone after that because delivery already happened, or whelping already happened. In other group, again, it is going down, which you can see. And what we have seen based on these studies is that when 1 or 2 fetuses are there, we have to be very cautious. Whereas when the number of puppies are more than 4, the response we can expect within 24 hours. And when number of puppies are less than 3, the response will be within say 24 to 48 hours. That is what we have seen. It mostly applies to most of the cases. And some other possible advantages of antiprogesterone in late pregnancy is that whenever it is given at 60 to 62 days post-ovulation, some of the recent studies claim that they may help in final maturation of puppies by inactivating progesterone receptors and promoting a physiological progesterone decrease. And this will be helpful even in planning an elective C-section also. And we have also conducted 1 or 2 studies here in our university also based on this, and we got almost promising results. So my final or current recommendation that what I can say is that on the first day, go for mifepristone at 3.5 milligram per kg, 8 to 10 hourly. Maybe on the second day also, we may have to repeat if it is not working. So 2 to 4 times. And after 24 hours, we can start bisoprostol at the rate 10 microgram per kg twice daily. And then monitor the dam and fetuses. That is very important, for which maybe if you want to see whether there is any cervical dilatation or plug lysis, those kind of things, we may require a vaginoscopy equipment. What we use is a sigmoidoscope, what I've shown over there. It's a very useful equipment. And then monitor the fetal heart rate and other fetal parameters and maternal parameters by ultrasonography also. So with that, we move on to the next topic, that is anestrus or aestrus induction. See, before giving any treatment for this condition, what I would say, just ask one question, whether the animal is really in estrus. Really in anestrus, because many of the animals which might have presented to you might have come to estrus, which the owner may not have noticed. That is one reality. And whether the animal is in early or late anestrus. So such questions we have to address first. And then another one important point that we must remember, the estrus cycle interval, although it is having an average of 7 months, it can range from 3.5 to 13 months in different animals. So that individual variation also we have to make sure. So the antiprolactinics are used as estrus induction agents. And one thing about antiprolactinics in estrus induction is that it was initially believed that it can be used in estrus induction due to the lowering of prolactin level. Later on, what the recent studies or the studies conducted at Utrecht University have proven that shortening of anestrus will occur irrespective of prolactin concentrations. So you might see the prolactin level on the graph shown above. You can see that the prolactin level are pretty high from mid metestrus to say late metestrus. So otherwise it is almost normal. But at any stage of estrous cycle, this drug has an action. That's what the studies have shown. And the dose of cabergoline is at the rate 1 to 5 microgram per kg. And what we can expect, estrus will occur within, say, usually within 30 days. In prolonged anestrus, this will be a better option. So, or in late anestrus, this acts fast. If it is early anestrus or if it is late metestrus, then it will take more time. And again, shortening of interestrus interval is another option, another condition which we may have to treat, wherein, say, even from day 10 of cytological diestrus, that is immediately after a previous estrus, day 10 of cytological diestrus, we can start giving cabergoline at the rate 1 to 5 microgram per kg once daily for 28 days. And what we have seen, the inter-estrus interval will be reduced by almost 3 months if the bitch is having an average of 9 months as its estrus interval. So there will be a reduction in the estrus interval. And cabergoline has been tried in different doses, different dose regimen across the world. And earlier we were giving at 5 microgram per kg. But what I would like to stress here is that even if you give it 1 or 2 microgram per kg also, you will get the action. Maybe you may have to give the drug for a few days more. For treatment of anestrus, we don't have to make the animal suffer for by increasing the dose. Only thing is that if you reduce the dose and limit the dose to the least effective level, if the animal is vomiting, for example, avoid that that high dose. Rather than, if you want, you can go for other antacids or something like that. But what I would like to say, stress here is that even adjusting the dose will be able to control all those side effects. And another thing, it should not be fed directly by mouth. Always mix the tablet, powder it, and mix it with food. And then when you give it, the side effects are least. So then comes the GNRs group, and among them the 1 second, estrus induction using equine chorionic gonadotropin and HCG. And this I have tried even during late 90s or mid 90s, even during my MBSc research also. And what I have seen, equine chorionic gonadotropin, it was available as one thing about the molecule, it was available till 1 or 2 years back. Now, ever since the beginning of COVID situation, it is not at all available here, but I think maybe after some time they will bring it back. So ECG at the rate 20 IU per kg for 5 consecutive days, followed by maybe in one group I gave HCG on the 5th day, and in another group I didn't give HCG, and I got almost similar result without giving HCG also. And see, at that time, many researches were conducted using this molecule by Arnold in 1989, and so many others. And what we have seen, any dose above 20 IU was not safe, and they had all the complications we could expect, like thrombocytopenia and not many other. And what I got, see, my research work was in early anestrus bitches, and among them 83.3% got, we could induce estrus, and we got almost a 50% conception rate. But what I would like to stress here is that if you use it in late anestrus bitches, the estrus induction will be to the tune of 100%, and the conception rate of 60 or 70%, or even more we can get. And that is what my personal experience is. And recently, I have seen one article, good article. They have used single injection of 50 IU per kg of ECG, followed 7 days later by 500 IU STG in anistra switches, and they got around 80% pregnancy with no side effects. That is what they claim. But I'm not definitely sure about this much of high dose, even though they have given only for a single day. Even then, I have a question. I mean, I have my own doubts there about this much dose. But I think we may try. But I have never tried this protocol. Even without that, also, if you give for smaller doses for 5 days continuously, without much side effects, we can get results. That is my concept here, but this can also be tried. Then comes the GnRH agonist leuprolide. This has been also tried by many people, and there are a lot many molecules available in India, a lot many products in human side. And leuprolide, in the initial studies, what they have done at the rate 100 microgram per kg, plus 3 microgram per kg of gonadorelin on the day 1 of the induced stress. And they have claimed something like 50% consumption when the drug was used in 120 days postpartum, and 100% when 150 days postpartum it was used. And the same protocol, we see when I have tried in some of the clinical cases, we have replaced gonadorelin with buserelin, but what I got was not this much level. Around 50 to 60% we can expect. That is what I have seen when we use the product. I don't know, because we have not used gonadorelin because that is not available here in India. Then comes estrus induction using PGF and leuprolide. There are some other studies wherein they have used dinoprost for 4 consecutive days at a higher dose. I would say it is a higher dose from 15 to 30 days after ovulation of a non-pregnant estrus egg. So that is also in early anestrus, when early stage of the cycle, or immediately after an estrus cycle when the animal is in the estrus stage only. And the results that they have claimed is something like say 83%, but I have a doubt in this case, because recently we have one of our students have worked with the same molecule, leuprolide, but instead of the normal PGF-12, we have used cloprostenol. And immediately after previous heat, when we have used the molecule, what we have seen, the consumption rates, even though we got estrus induction or estrus response like to the tune of 83.33%, the consumption rate was very low, like 16 to 20%. So again, when we have used the same protocol in typically any late anestrus cases, we got good results, but in that case, cloprostenol is not applicable there. That is the thing that I would like to convey here. So PGF can be used again in shortening inter-estrus interval. So PGF, when given from 10th day of cytological diestrus, say for like a 6 to 10 day course, it will result in complete luteolysis, shortening the diestrus and often the anestrus too, and return to next season 70 to 90 days from previous coestrus. So that is what we have seen. And alternatively, after shortening diestrus with PGF, antiprolactinics can be used to shorten the anestrus. That is also another thing. And another molecule which you can consider is something like deslorelin. Well, since this molecule is not available in here in India, we may skip that. And as far as estrus induction is concerned, I would say ECG or leuprolide is not as a first choice of estrus induction for estrus induction. ever since cabergoline is widely available and they are orally effective and reasonably good consumption rate, currently the choice of stress induction agent in small animal practice is cabergoline. But when it does not become effective, ECG or leuprolide can be considered also. Earlier in late 90s or early 2000 also, it was not available. Then another question that we may think about is hastening or inducing ovulation. I would say it is rather a blind therapy to induce ovulation and adequate development of CL. When HCG should be given, that is a big question. HCG at the time of mating, some people may give it at the time of mating, but we are not getting a balanced result. In prolonged pro-estrus, for example, if it is more than 3 weeks, HCG at the rate 25 IU per kg may possibly hasten ovulation. And what I can suggest here is like when 90% of vaginal cells become anuclear, or when a slight rise in progesterone has occurred, if you give a HCG, that may give a better results than many of the other pattern what we try, or at the time of mating, or at the time of second mating, or something like that. Then another thing about HCG administration is that premature administration of HCG can lead to follicular luteinization, oocyte capture, and ovulation failure. Now, the next condition is pseudo-pregnancy, and the drug of choice as far as pseudo-pregnancy is concerned is the antiprolactinic drugs, because of their anti-lactogenic action, and they are the treatment of choice as far as pseudo-pregnancy is concerned. And the dose rate is 1 to 5 microgram per kg once daily. Here also the dose we have to limit to the maximum level the animal can tolerate. Cessation of lactation is another condition where the indications are when a bitch has lost its litter, or milk production continues after weaning, or milk let down during pseudo-pregnancy, or conditions like galactostasis. In all such situations, the cabergoline can be given at 2.5 to 5 microgram per kg once daily for 4 to 6 days. And the next condition is treatment of habitual abortion. Here, I would like to discuss about most of the progesterones that people may think about using. The most important side effect of progesterone we have to remember before supplementing any animal with progesterone during pregnancy. So progesterone supplementation during pregnancy may produce masculinized female fetuses, cryptorchid male puppies, and may delay or impair parturition. These are the possible outcomes that we can expect, or complications. And therefore, it is not usually given to pregnant bitches. And only in true habitual abortion it can be. So wherein you have to assess the progesterone level. But again, the progesterone level in which what level is okay for that animal is again a tricky situation. Wherein in some animals wherein you have more number of puppies, the progesterone level may be higher. Or some animal, even with low progesterone level, they can continue pregnancy. So this is a very tricky situation. And if at all some people are going for progesterone administration, only oral route, no injections are allowed. And maybe products like megestrol acetate or medroxyprogesterone can be considered, but as far as I am concerned, I won't use these molecules in a pregnant animal, that is for sure, because that has given us a lot of problems also. But since many people are asking what progesterone we can give during pregnancy, I have given that. You can say that, see that I have striked it also. It should not be used like that. So what I prefer in such a situation is something like antibiotics and uterine spasmolytics like isosuprene. And we are getting excellent results. That is what I would say with these combinations of antibiotics if necessary and uterine spasmolytics like isosuprene. Then the next condition is agalaxia. Metoclopramide is a D2R antagonist and increase prolactin secretion. That is the action that we expect here. And low doses of metoclopramide of 0.2 to 0.5 milligram per kg subcutaneously per orally twice daily or thrice daily. And this may be increased to higher doses of 1 to 2 milligram per kg if it is not giving the required effect within say 2 to 3 days or so. And the efficacy of using metoclopramide is greater than 50% in increasing milk production. And some points we have to consider: start with small doses, and if no response within 24 to 48 hours, gradually increase the dose every other day. So the start with 0.2 to 0.5 milligram per kg, slowly increase to 1 to 2 milligram per kg. And extrapyramidal signs are common at doses over 2 milligram per kg. And treatment should be continued for at least 2 to 3 days beyond when milk production is adequate. Then domperidone is another molecule that we have to consider. That is also a peripheral D2R antagonist. And see, the side effects are not much when we compare with metoclopramide. And but the researchers using these two molecules are less. And with domperidone again, only very few researchers have come out. But across the world, the small animal clinicians use the drug, maybe by word of mouth publicity and all. And it is given in many of the recent articles and recent textbooks. And the dose for queens are 1.5 to 1.5 to 2 milligram per kg twice daily for 2 to 3 weeks. Bitches 2.2 milligram per kg twice daily for 2 to 3 weeks. And the side effects are a manageable diarrhea. That is the most common thing that you can expect, and behavioral changes in some bitches. And it is, however, better than metoclopramide. That is what some researchers says. Antipsychotics like chlorpromazine, azithromycins are not usually used in canines and felines in agalaxia cases. In dystocia or medical management, we use the hormone oxytocin after supplementing with calcium, which gives strength for uterine contractions, and dextrose, which gives energy, 25% dextrose. And then oxytocin increases the frequency of uterine contractions. We must remember that the half-life of oxytocin is only 1 to 2 minutes, and the permitted dose for dystocia management in canines is 1 to 3 IU, which can be given IM subcutaneously or intravenously. And the minimum interval between the successive injections should be somewhere around 45 to 60 minutes, or preferably 90 minutes. And high and repeated dose of oxytocin will lead to uterine tetany. Instead of contractions, it will lead to uterine tetany, and they compromise fetal oxygen supply by placental, because of placental separation, constricted umbilical vessels, maternal vasodilation, and hypotension. Postpartum hemorrhage in bitches can be managed with giving ergonovin, which is an ergot alkaloid. They have strong uterine contractions, and they should not be used to treat canine dystocia. That is a warning. And indications of ergonovin are postpartum hemorrhage, uterine contractions, because it will lead to uterine contraction and vasodilation. And again, in delayed involution of uterus, in both the situations, we can give it at the rate 10 to 30 microgram per orally. Or intramuscularly also. Injections are also available twice daily, or even thrice daily also you can think about, depending on the situation. Treatment of feline mammary hypertrophy. Young queens at their first luteal phase sometimes are presented with benign fibroglandular proliferation of one or more of mammary glands. They're called benign mammary hypertrophy. Most or all glands will be swollen and firm and nodular in 2 to 3 days. You can see in the picture also. And some may have spontaneous cure, and PGs and antiprolactins are not effective. High dose of aglipristone are effective in some of the situations. And I have tried also in a few cases with mifepristone, and it is giving promising results. The last area that we are going to discuss is the contraception, misalliance, control or postponement of estrus cycle, and pregnancy termination. See, as far as estrogens are concerned, we have been using it for misalliance and juvenile vaginitis and estrus induction earlier, but because of the complications, currently not recommended. Most of these products are currently not recommended. But in attractiveness in ovariectomized bitches, first try with a topical ointment or ethinyl estradiol at the rate 0.06 milligram per kg up to 7 days. Lineural tablet is available, but again, I would say these days, even using ethinyl estradiol also not very safe. Tamoxifen is another molecule which I would like to discuss, because we have used it for many years. Earlier times we thought that this is a safe drug, and in mesh mating it was effective at proestrus, estrus, and diestrus. Even up to 15th day of diestrus also it was effective, and the dose was around 1 milligram per kg, orally twice daily. And but later on, what they have seen that the tamoxifen, although it was thought that it is an anti-estrogen, later the researchers found that it is actually estrogenic in canines, as I have discussed before in the initial part of the discussion. So the side effects that what we see are like during proestrus, it may lead to pyometra. During proestrus and estrus, it may lead to cystic ovaries, endometritis. So these are the conditions that we can expect, and therefore it is not at all widely accepted or not at all used by most of the clinicians across the world nowadays. Androgens, among the androgens, for prevention of estrus, the accepted drug is Miboldron or check drops in US. They are using it for long-term prevention of estrus, but unfortunately that molecule is not available in India. So other actions we will skip. And again, another drug that is available in India is progesterone, delvesterone. The dose in bitches are 10 to 33 milligram per kg. I am not a good supporter of this molecule, but since it is available and since many are using in the metros, I would like to discuss it over here. Because if you don't want to breed an animal, go for OIC. That is the best option that we can think about. Estrus control or permanent postponement of heat, temporary postponement of heat, or suppression of heat. In bitches, in queens also, permanent postponement of calling, temporary postponement of calling, and suppression of calling. This can be considered. And in feline miliary dermatitis, this is advisable at 50 milligram per kg. I have not tried in any case, so I cannot say any verdict on that drug. Then pregnancy termination bitches and queens using agliprostone, since that molecule is not available. But one thing about agliprostone is that even in early pregnancy that is effective, but unfortunately it is not available here. When you think about mifepristone, they can be used to terminate pregnancy at any stage. That is what literature says. But what we have seen, it is not effective at 0 to 25 days, not very effective, 0 to 25 days post mating. And in routine practice, it is used from 30 days at 2.5 to 3.5 milligram per kg, twice daily for on an average 4.5 days. And rarely we may use it up to 7 days or more. And ultrasonographic monitoring of complete resorption or evacuation of contents should be done periodically. Then antiprolactinics or prolactin antagonists, they are effective in terminating pregnancy from mid-gestation. So from day 25, it is almost effective. And after day 40, if it is administered consecutively for 5 days, it is giving good results. And when treatment is started at 25th day, some animals may require a retreatment. And combination of cabergoline or PGF or mifepristone and cabergoline or mifepristone and misoprostol, these kind of combinations are giving even better results. Prostaglandins luteolysis and depress progesterone to non-detectable levels after 25 to 30 days of pregnancy. So 4 to 5 days course is required. In early pregnancy, what we have seen is that we require prolonged treatment, and in queens recommended from mid-gestation. So there is about PGF2 alpha in termination of pregnancy. And termination of pregnancy can be tried with dexamethasone also. Dexamethasone is an abortive agent from 30 to 50 days of gestation. And the usual dose, what internationally accepted dose, is around 0.2 milligram per kg twice daily for 10 days. Same dose for 10 days is also accepted as per many of the reputed authors also. And in fact, we can think about tapering doses also, but what we have seen, tapering doses, it may not work in almost all the situations, whereas if you give for 10 continuous days, most of the cases it is also working. But again, we may have to monitor by ultrasonography. So urinary incontinence is the only condition wherein the estrogens are currently recommended. So long-acting estrogens like diethylstilbestrol, estradiol, or estrone are not recommended usually in dogs because they have deleterious action on the uterus and bone marrow due to their prolonged nuclear occupance time in estrogen receptors of target tissue. And this can lead to pyometra or fatal myelotoxicity. So currently, the only estrogen preparation that is accepted is estriol. 0.5 to 2 milligram is the dose recommended. And what we can do, we start with say 1 milligram pill once daily orally for 1 week. And thereafter, if it is not giving the required results, we may increase the dose to slightly, or if it is giving result, we may try to reduce the dose so that we find out the least possible dosage for that particular molecule. So when the dosage are limited to 0.5 to 1 milligram per kg, no abnormalities have been reported. So that is about estrogen in canine. Currently, this is the only situation wherein if it is not, if the urinary incontinence is not responding to the normal sympathomimetic drugs, then we may think about this molecule estriol. That too, when other things are not working, and limit the dose. Even in ovaryhysterectomy dogs also, we had to limit the dose. That is the advice. And the current recommendation as far as contraception or pregnancy termination with the available molecule in India, we Indians are concerned, OHE is a recommended one if it is not meant for breeding. And pregnancy termination can be done using mifepristone, cabergoline, or PGs, or combination of these. And with that, I would like to conclude with a statement by Professor Ettinger. It takes the best in each of us to bring out the best in all of us, because we are facing a lot of problems as veterinarians nowadays. And let us stay united and face the problems. United we stand, then we can face it. And for that, I read the sentence once again. Let us bring out the best in each of us to bring out the best in all of us. Professor Ettinger is also remembered on this conference. And with that, let me thank one and all for the patient hearing. And I will try to answer the questions, whatever are there in the chat box. There's a question like, sir, can I proceed?
Sir, 1 minute, sir.
Yeah.
Sir, there are some questions in chat box.
Yeah.
I think you can read it, then it will be very good. You can answer it, sir.
At what ratio misoprostol should be diluted with saline solution for intravaginal injection to facilitate cervical opening? Actually, misoprostol, you can take it into a syringe, just break it, need not crush it, just break it and put it in a syringe and add normal saline. Any saline will do, even distilled water also will do. Then say if it is only one tablet, you can say around 10 ml or 20 ml. 10 ml would be sufficient, because if you increase the volume, there will be backflow also. So what we do, 5 to 10 ml we will minimize, and it readily dissolves in. Only thing is that it sediments also. So just shake the syringe and then slowly infuse it with our AI sheet. That can be done. Another question is effectiveness of pyometra treatment alone with oral tablets like Myfi, cabergoline, and miso, and antibiotics plus US ultrasonography. I mean, it should be ultrasonography. See, I've given in that thing also, in the presentation also, when we combine cabergoline, mifepristone, and misoprostol and antibiotics, what I have seen, clinically, we are getting good response and very good cure. If the animal can take oral medication in such a situation, it is giving promising results. But if it is having vomiting or some other problems, it cannot be fed. I mean, given medicine cannot be given orally, means that then there can be a problem. Otherwise, it is a good combination. Only thing is that we have to closely monitor. Maybe even if I say that you can give cabergoline for say 10 to 12 days or 12 to 14 days, you have to period. I mean, after the course, at least we have to go for progesterone estimation and see whether it has touched the basal value like below 0.5. Preferably, my aim in treating any pyometra case is that I should get a value below 0.5 or preferably below 1. But better option is to have below 0.5. The next question, cabergoline in anestrus for how many days for induction of estrus? So that's a good question again. In anestrus bitches, usually, see, if it is in late anestrus, as I told, we can expect usually I go for a cytology also. Slight proliferation of mucosa can be seen by increase in number of the cells, maybe small intermediate cells and large intermediates will there will be increase in number, and some parabasal also. So that itself gives us a clue. As you know, the cytology picture in anestrus will be very few cells in here and there only. It will be there on the microscopic slide. Whereas in late anestrus or early proestrus, when it is approaching early proestrus, you can see more number of cells. So that is why we go for cytology there. Progesterone assay, we may not get any result unless it reaches an early proestrus stage. So then in late anestrus, we can expect somewhere around 14 to say 28 days. And in say mid anestrus or early anestrus cases, maybe up to 42 days, we may have to give it. So usually by 42 days, if I'm not getting a result, I may stop for some time. And then maybe after 1 month only, we will start the treatment again. And for how many days cabergoline are given in pseudo pregnancy in cat and dog? Usually in pseudo pregnancy, as I told before, see within say 6 to 8 days, 6 to 7 days, usually the signs will subside. But if there is a prolonged sign, at times we may have to give it for 7 to 14 days or even more also, but maximum 40 within 7 to 12 days we get a result. That is what we have seen. What is the dose of isosuprane? That's also a question because that we have to find an answer at, because there are not any good publication based on this. See, based on clinical experience only what I am using. So for example, for a 30 kg up to a 30 kg dog, we may limit to say 10 milligram as the total dose. So because that is available as a 10 milligram tablet. So many products are there, like Tidilan or Dividilan. So many products are there. So we will limit to say 10 milligram per kg twice daily. And if it is over say 30 to 40 kg, we may even give 15 milligram twice daily. That is what I usually do, because per kg dose I won't be able to say in this case. So we have tried in many cases and we are getting almost very good result with this kind of dose regimen. For temporary arrest of sexual desire in Tom, what is the best hormonal therapy if owner not want to neuter? That's a good question, but currently I won't be able to say any other choice other than the delvosterone in Tomcat that's also not applicable. I'm not definitely sure. I may have to go through some other literature to find out this one, because usually when they are not going for breeding, usually they come for castration or neutering. That is what they usually do. Usually we have never tried with any of these molecules because of the non-availability of most of the drugs that can be considered also. Then another question, can we use ergonovin in open pyometra? Open pyometra, we won't recommend ergonovin, because ergonovin is given only to control postpartum bleeding, or to go for involution of uterus. For pyometra, it is not recommended right now. Maybe it may have some effect, but I'm not sure. I won't recommend also, for at least based on the current knowledge with regard to that drug. What about other effects of dexamethasone? Dexamethasone, with 0.2 milligram per kg, what I have suggested, it is based on so many research. Actually, there are not many publications based on that also. And we have also tried, and apart from some increase in thirst, other than that, we have not found any problem associated with that treatment. And finally, once you stop that, usually it is solved with that. But again, these days we are not going for dexamethasone in any of the clinical situations for say termination of pregnancy, because we have other safer and directly acting molecules. Causes of pyometra, so that's a big question, because of the lack of time. Actually, we couldn't discuss that more, because that will take a lot of time. But even then, as I have said, it's a progesterone mediated, and there will be infection of the uterus also, if you say it in short words. And the endometrial glands will be swollen, or endometrial glands will be active because of the influence of progesterone. And at that time, if there are some organisms, because most of the organisms causing pyometra in canines, or the bacterial organisms causing pyometra, are normal inhabitants only. So that is about causes, but I may not be able to elaborate it because it's a big topic. We may require a lot of time also for that. Use of estrogen gel per rectum for urinary incontinence. Yes, for urinary incontinence, some estrogen gel or estrogen preparations are tried, but usually it may not be very effective also if it is a real problem. So for that only we have sympathomimetics, and if sympathomimetics are not working, I think to answer that question, I will show one more slide. Hope that is visible. These are the sympathomimetics that we can think about: phenyl propanolamine, ephedrine, pseudoephedrine, phenylephrine, and imipramine. Many human preparations are available. Among them, imipramine is a molecule that is available as such, a single molecule. Otherwise, all other phenyl propanolamine will be available along with paracetamol, some other combination, whatever human products are available. But veterinary preparations are there. Currently, I don't know whether it is available in any part of India. In Kerala, anyway, it is not available. So that is about that one. Then another question, sir, will there be any lactation in aborted or medically terminated pregnancies in canines? Aborted? In aborted or even medically termination. Medical termination, if you are doing it, say around 45 days or 50 days when there is milk let down, then there can be lactation. That's of course that will be there. Another question, cabergoline and bromocriptine can be given for how many days, and at what dose. That already I think we have discussed. Bromocriptine, here I would like to stress again, as I mean, we are trying to avoid that molecule because of the more side effects associated with that. So please go with carbapenem. How many days isosuprene have to be continued? That's also a good question. Usually what I do, if a dog had an abortion, say around 45 to 50 days, also in the previous pregnancy. So we have to go for an early scanning, ultrasonography. Maybe by around 25 days we do an ultrasonography, and from that day onwards we give isosuprene, and we continue that till say 3 to 5 days before the expected day of whelping. Till then we usually continue. That is what I can recommend here, and I think with that almost all the questions in the chat box.
Okay. Now there are a lot many queries among the participants regarding the reproductive point of reproductive disorders and its medical management. So on behalf of the organizing committee, sir.
Excuse me, Ingole sir.
Sir.
Shibu sir, please stop your sharing. Sir. Shibu,
okay,
sir.
okay, sir. Okay, sir. Okay.
So on behalf of the organizing committee, on myself, I am very much thankful, sir, for accepting our invitation to be one of the eminent speaker in this national online training and sharing your valuable experiences of 20 years on medical management of various reproductive disorders. On behalf of the organizing committee, PJVS Akola and university, I again thanks for sharing your valuable experiences. Thank you so much, sir. Thank you.
Thank you so much.
I request Dr. Fazay sir to proceed for the next presentation.